So, good evening, friends, and welcome to this Pan India Intercollegiate PG quiz, which is being hosted by Brain Teasers in association with Ophthalmological Society of Nagpur, and that's the big Q. So, this is the tune of our Q. All guests and speakers.
आठ समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं है।
तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So, good evening, friends, and once more, welcome to this 7th episode of this 3rd season of Big Q. Yes, of course, it's a special day today, Valentine's Day, which is celebrated as a day of love and romance all over the world. But do you know why is it called so? Well, it was called as Saint Valentine's Day or the Feast of Saint Valentine, which was originated as a Christian feast day honoring a martyr named Valentine. Now, as you all know, Brain Teaser is an online platform for main for quiz hosting the quizzes for all ophthalmologists of our country, and BQ is for means next step of for all postgraduates across the country, and this is the 3rd season of BQ. This season has 8 preliminary rounds. Today is the 7th preliminary round. One more round is to go, and then there are 4 quarterfinals, 2 semifinals, and 1 finals. As we are all aware, the episodes would be aired on alternate Wednesdays at 8 p.m. Now, let me welcome and thank the team of quiz masters who have toiled hard to create a wonderful experience of learning with fun for today. For today's episode, I welcome Dr. Tushar Grover, who is a medical director and consultant at Vision Eye Center, New Delhi. Dr. Jaspreet Sukija, who is a professor of pediatric ophthalmology and neuro-ophthalmology at Advanced Eye Care, PGI Chandigarh. Dr. Archana Kumari, who is a director, head of retina department in Prasad Eye Hospital, Ramgarh, Jharkhand. Dr. Rajul Parekh, who is director of Sriji Eye Institute and Research Center at Palax Glaucoma Care Center, Mumbai. Unfortunately, because he's down with temperature, Dr. Shilpi will be helping out with that part of the thing. But we are really thankful for his contributed all his questions for the today's quiz. And of course, last but not the least, Professor Dr. Murli Manohar, who is a senior professor and head of the Department of Ophthalmology at SP Medical College, Bikaner. As we are all aware, such a mega project is not possible without a strong financial support from pharma. Microvision has been our steadfast partner since last 3 seasons. Our sincere most gratitude to Mr. Ashokan, Mr. Kumaran, Mr. Navnit, and all the field force of Microvision for all the help they have rendered. We are, of course, thankful to Mr. Sai, who has been associated with us, taking care, his team, Numerotech team, which has been taking care of the back-end work, which is responsible for smooth and flawless execution of quiz. Now I request Dr. Shelpi to familiarize you all with the rules of the quiz.
So good evening, friends. Welcome all. Happy Valentine's Day to everyone. So quickly we'll see the rules. Before that, this was the promo from the So as you all know, there are total preliminary 8 rounds, 8 preliminary rounds. So total of the best of the 5 performances will be calculated for qualifying into the quarterfinals. And today's is the 7th episode. So one more episode to go. So every team has to log in from 2 devices. The first screen is the Zoom platform for the live quizzing, and the second screen is the Kahoot to answer. So there will be total 10 sets. Each set will have 5 questions, 10 seconds for per question you will get, and there will be no negative marking. So the fastest finger first will be the criteria to categorize who won the prize. And these are the various prizes for the PGs in the finals, for the mentors, and for the audience prizes. These are the prizes per episode. So now let's play our sample question for today to see whether the Kahoot platform is working properly or not. So 14th Feb is celebrated as, and your options are A, Black Day, B, Organ Donor Day, C, Ferris Wheel Day, and D, all of the above. And your time starts now. So now let's see what is the answer. Yes, the answer is all of the above. So with this, I welcome our first quiz master, Dr. Tushar Grover, who is a medical director and consultant at Vision Eye Center, New Delhi. He is also consultant at Sir Gangaram Hospital, New Delhi. He is a cornea, cataract, and refractive surgeon. He has delivered many invited faculty talks and research papers at various international and national forums, including the European Society of Cataract and Refractive Surgery, Asia Pacific Association of Cataract and Refractive Surgery, Asia Pacific Academy of Ophthalmology, All India Ophthalmological Society, and Intraocular Implant and Refractive Society of India. He has also received various awards, including the Best Video in American Society of Cataract and Refractive Surgery, International Heroes Award at the All India Ophthalmological Society, and Best Paper in Delhi Ophthalmological Society. He has numerous publications to his credit in various national and international journals, including Journal of Refractive Surgery and Indian Journal of Ophthalmology. With this, I hand over the screen to Tushar sir.
Thank you so much, Dr. Shilpi. So happy to be here. Let's start with the questions then. So this is going to be the section 1. And the first question is in front of you. Which of the following layers of the cornea is not a part of the graft that is implanted in the image here? So this is a graft that has been done. You see the graft. This is post-op day 1. Which of the layers has not been transplanted in this graft? Your time starts now. A, endothelium. B, Descemet's membrane. C, stroma. Or D, Bowman's layer. So time starts now, I guess. Okay, so the correct answer is the D, Bowman's layer. So we can move on to the explanation. So this is essentially a DSEC graft. You can see that there is just 2 sutures there. There's an air bubble in place. So in a DSEC graft, you're implanting the endothelium, Descemet's membrane, and also the posterior stroma. The Bowman's layer or the anterior stroma and the epithelium are not a part of the graft that is implanted in DSEC. So that is the reason. I hope most of you got it right. So let's move on to the next question. So the next question is, you see this image here, which of the following conditions is not associated with this corneal degeneration? And your options are A. Uveitis, B. Intraocular silicone oil, C. Keratoconus, or D. Hyperparathyroidism. So your time starts now. And the correct answer is C. Keratoconus. So let's move to the explanation. So this is, most of you, I hope, got it right. This is band-shaped keratopathy. This is associated with various conditions such as uveitis, intraocular silicone oil, and hyperparathyroidism. Keratoconus is not associated with band-shaped keratopathy, which is why keratoconus was your answer. Let's move to the next question. Okay. So the next question is, you see an image of a patient that has just undergone femtosecond LASIK. Which of the following challenges is likely to have been encountered in this case? So the options are difficulty in flap dissection, B. Suction loss, C. Failure of pupil tracking, and D. Refractive overcorrection. So the arrow gives you an idea of what we are talking about, and your time starts now. Okay, so the answer here is failure of pupil tracking. What you see next to the arrow pointed there is essentially a gas bubble in the anterior chamber. So that happens occasionally with femtosecond LASIK, where air migrates into the anterior chamber, and because you have air in front of you, the machine is not able to track the pupil. And so failure of pupil tracking is the answer for that question. Let's hope most of you got it right. So let's move on to the next question. Okay. The next question is, you see something in the image here. Which serotype of chlamydia trachomatis is likely to have been responsible for this sequelae that is demonstrated in the slit lamp photo that you see? Your options are, the option B is serotype D, the next option is J, and the last option is K. Your time starts now. The correct answer is C. Let's move to the explanation. So what you see is a sequelae of trachoma. You see a Herbert pit there. And trachoma is caused by serotypes A, B, BA, and C, which is why the answer in this question is C. The other serotypes are not responsible for causing trachoma. They usually cause either ophthalmia neonatorum, or they cause adult inclusion conjunctivitis. So let's move to the next question now. Okay, the next question is, how many points on the cornea does this instrument use to estimate corneal power? The options are A, 1, B, 2, C, 3, D, 4. So your time starts now. And the correct answer is D, 4. Okay, so let's move to, so this is essentially what you can see, a manual keratometer. Typically, a Bosch and Law manual keratometer is what this is. And it estimates the corneal power by reading 4 points of the central 2.8 to 4 millimeter zone. So let's move to the next question. Okay, so that's all from this section. Let me take the honor of introducing the next quiz master, Dr. Jaspreet Sukhija, who is a professor in pediatric ophthalmology and neuro-ophthalmology at Advanced Eye Center in PGI Chandigarh. He's been trained at Great Ormond Street Hospital of the Moorfields Eye Hospital in London. He's also the president of Chandigarh Ophthalmological Society and the joint secretary of North Zone Ophthalmological Society and managing committee of AIOS. He has numerous publications, more than 120 publications in peer-reviewed journals, and has contributed various chapters in books. He also has various honors. It's a very long list, so I'll read out some of them. He is an associate editor of Acta Ophthalmologica, section editor of the strabismus section in IJO. He's received Excellence in Strabismology Award by SPO-SI and the AOS International Ophthalmic Heroes Award. So various awards, and let me have the honor of introducing him and welcoming Dr. Jaspreet Sukija.
Thank you, Tushar, for that kind introduction. And so we'll move on to our next set of questions, which is section 2. So can we have the first question? Yes. So our first question is, acquired esotropia is associated with, the choice A is homonymous diplopia. Is it heteronymous diplopia? Is it confusion? And the last option is excellent stereopsis. So your time starts now. Yeah, so the correct answer is homonymous diplopia. So homonymous diplopia is also called uncrossed diplopia, as the false image falls on the same side. So in exotropia, what happens? There is cross diplopia, which is also called heteronymous when the false image is seen on the opposite side. So if you see the first image, the patient has esotropia. Now what is happening here is the nasal part which is receiving the image. So the nasal part is used to the temporal perception. So temporal means it will be on the same side. And the opposite happens when the patient has exotropia. Can we move on to the next question, please? Yeah. So the second question is, facultative suppression occurs, option A, always after abnormal retinal correspondence. B, usually associated with marked decrease in visual acuity. Is seen when the squinting eye assumes fixation. The last option is a compensatory mechanism for diplopia. Your timer starts now. So the correct answer is D, is a compensatory mechanism for diplopia. So what happens is, why it happens is, it is to avoid visual confusion and diplopia. Our visual system uses the mechanism of suppression and an anomalous retinal correspondence. So facultative suppression is present, was in our question, when the eyes are deviated and is absent in all other states. So like patients with intermittent exotropia, for instance, often experience suppression when the eyes are divergent, but may experience high-grade stereopsis when the eyes are straight. So it is a compensatory mechanism. So if you see here, what happens is you have the fixing eye and you have the deviated eye. So the correspondence which is occurring is this area of suppression. That is why the patient does not have diplopia, because he develops what is known as suppression. Can we have the next question, please? Yes. So our third question is, an 8 mm inferior oblique recession is obtained by, your first choice is Fink's procedure. Option B is Park's procedure. Option C is Elliott-Nankin recession. And D is total anterior positioning. So your time starts now. The correct answer is Fink's procedure. So what is a Fink's procedure? What he did was, the anterior edge of the inferior oblique is inserted 6 mm inferior and 6 mm posterior. So it's 6 mm inferior and 6 mm posterior to the inferior edge of the lateral rectus. And the posterior end is reinserted 6 mm posterior to the recessed anterior part and which is parallel to this inferior rectus. So this provides an 8 millimeter recession. But this becomes a little complicated. So what happens is in correlation to the inferior rectus, it is a point which is 4 millimeters posterior to the inferior rectus and 4.4 millimeters superior to the lateral border of the inferior rectus. So that becomes the Fink's point, and what is required for an 8 millimeter recession of the inferior oblique. The Parks provide a 12 to 14 millimeter recession effect, so that's much larger. So our next question is, Del Osso procedure is indicated in nystagmus with null in levo version. Option B is nystagmus with no null zone. Option C is optokinetic nystagmus. And the fourth choice is end positional nystagmus. And your time starts now. The correct answer is nystagmus with no null zone. So basically, Del Osso procedure is a tenotomy with reattachments of the muscles. Why it's done, what is the reason is there is a change in the activity of the proprioceptors that are present at the insertion of the extraocular muscle, an activity that is secondary to surgery. So that is how they say it would dampen the nystagmus. Next question, please. Yeah, so our next question is A pattern strabismus. It's the A pattern, not A pattern strabismus occurs due to superior oblique underaction. Option B is difference in down gaze and up gaze is 6 prism diopters. Option C in Brown syndrome. And option D is due to displacement of the muscle pulleys. Your timer starts now. And the correct answer is due to displacement of muscle pulleys. So what are the causes of A pattern? Either it is a medial rectus underaction in down gaze and a lateral rectus underaction in up gaze, or it could be a superior oblique overaction where the tertiary action comes into play, which is abduction in down gaze, or it could be superior mislocation of the lateral rectus pulleys, and which was the correct answer. Thank you. I'd like to introduce our next quiz master. She's Dr. Archana Kumari, who's done an MBBS from Kolkata and MS from Kolkata as well. She did a fellowship in vitreoretinal surgery from in Lahan, Nepal, and she's presently the director, head of retina department in Ramgarh, Jharkhand. She's also the DNB teacher in Bhagwan Mahavir Medical Super Speciality Hospital, Ranchi. She's been the recipient of Manjul Pant Gold Medal Award for Best Retinal Surgery Video in 2023. She is the author of many peer-reviewed publications and a very enthusiastic speaker who has widely presented in many national and international forums. I'll like to hand over the next session to Dr. Archana Kumari, please.
Thank you, sir, for the introduction. Good evening, everybody. Now let's start with the questions. The first question, please. Fundus autofluorescence finding named as Robson-Holder ring is characteristic of A. Stargardt's, B. Retinitis pigmentosa, C. Pigmented perivenous retinochoroidal atrophy, D. Dry AMD. Your time starts now. So the answer is that a FAF finding Robson-Holder ring is characteristic of retinitis pigmentosa. The explanation is Robson-Holder ring is seen in retinitis pigmentosa, and it is a normal preserved retina at the posterior fundus bordered by a hyperautofluorescent Robson-Holder ring. Next question. Following is not true about gyrate atrophy. A, it is due to various mutations in OAT gene, which is found in chromosome 10q26. B, it is a rare autosomal recessive retinal dystrophy. C, it is due to depletion of plasma ornithine levels. D, few patients are favorably responsive to supplementation with vitamin B6. Your time starts now. So the false statement about gyrate atrophy is that it is due to depletion of plasma ornithine levels. Option C. So gyrate atrophy is characterized by progressive chorioretinal degeneration, and it is caused due to deficiency in the enzyme ornithine aminotransferase, which results in 10 to 20-fold increase rather than decrease in plasma ornithine concentration. About LHON, that is Leber's hereditary optic neuropathy, which statement is false? A, it is a mitochondrial inheritance, mostly maternally inherited, but can be paternally inherited too. B, 3 common mitochondrial DNA mutations, M11778 GA MTN D4, M3460 GA MTN D1, M14484T C MTN D6 account for about 90% of the clinical cases. C, it presents in male at 15 to 53 years of age. And D is, it is always bilateral. Your time starts now. So the false statement about Leber's hereditary ON is it is a mitochondrial inheritance, mostly maternally inherited, but can be paternally inherited too. So the explanation is that LHON is a mitochondrial inheritant degeneration of retinal ganglion cells and their axons, which is transmitted only through mother, as it is primarily due to mutation in mitochondrial and not the nuclear genome. Clinically, there is an acute onset of visual loss, first in one eye and then few weeks to months later in the other eye. The age of onset is between 15 to 53 years, and 3 common mitochondrial DNA, as we had stated in the options. Mutations code for NADH dehydrogenase protein involved in normal mitochondrial function of oxidative phosphorylations. The fourth question is regarding choroidal colobomas, which statement is true? So here we are asking about true statement. A, always genetic and associated with systemic anomalies. B, it is invariably associated with poor vision. C, 2.4 to 47.5% risk of retinal detachment. D, PVR is never associated with colobomas related retinal detachment. So let's start the timer. And the answer is the true statement about choroidal coloboma is that 2.4 to 47%, 47.5% risk of retinal detachment is associated with it. Choroidal coloboma is due to defective closure of embryonic fissure, and it can be sporadic or genetic. Depending on the type of choroidal coloboma, that is the extent of involvement of macula and the disc, it can cause normal to remarkable decreased vision. Its actual prevalence is not known, but in few hospital-based studies, they have reported it to be about something between 2.4 to 47.5%. And coloboma RD, due to breaks in intercalary membrane, have less or delayed PVR as compared to normal reg RD. But definitely they do come with PVRs. RPGR-associated X-linked retinitis pigmentosa. Identify the incorrect statement. Option A, rapid disease course in XLRP compared with other genetic subtypes. Option B, presentation is in 6th decade of life. C, clinical statokinetic dissociation. D, progressively decrease in ellipsoid zone width is characteristic of it. Your timer starts now. So the incorrect statement about RPGR-associated X-linked retinitis pigmentosa is that it is B, that is presentation is in the 6th decade of life. Now, retinitis pigmentosa GTPase regulator-associated X-linked retinitis pigmentosa is one of the rare and most severe form of RP. And because it is severe, we know that it is, though it is more common in males because it is X-linked, carrier females also can have minor symptoms, and the disease course is rapid as compared to the other subtypes. It presents in the 2nd decade of life. It is very difficult to monitor its progression. However, it displays a very characteristic clinical statokinetic dissociation. The progressive decrease in ellipsoid zone width has also been noted as a clinical marker, and it goes parallel with the edge of visual field. Now I take the opportunity to introduce our next quiz master, who is none other than Dr. Rajal Parekh, who is a well-known glaucoma specialist. He is the director of Shriji Eye Institute and Research Center, Palak's Glaucoma Care, Mumbai, chief editor of GSI Guidelines, first edition 2021. He is in the editorial board of International Glaucoma Review from 2018 onwards. He is a member of Education Committee, World Glaucoma Association. He is an Associate Advisory Board Member of World Glaucoma Association, Glaucoma Society of India Treasurer 2005-6. He has many feathers in his cap. He has about 55 publications in peer-reviewed journal and about 17 books. He has many chapters. He's also contributed to World Glaucoma Association Consensus Book and is receiver of prestigious award like FDC Award for work in glaucoma pharmacotherapeutics and Bell Pharma Award for his work in neuro innovations in glaucoma surgery. So over to Dr. Rajal Parekh, sir.
As we all know that sir is not well, so I will be taking care of his part. So coming to section 4, the first question is, who was the first person to associate glaucoma with a rise in the intraocular pressure? Your options are A, Dr. William Meckens, B, Ed Tabari, C, von Graffi, and option D, Hippocrate. And your time starts now. Time is up. So let's see what is the answer. Answer is option B. So it was in the 10th century, which was written in the Arabian writings in the book, that is the book of Hippocratic treatment, where it was defined as glaucoma as the rise in pressure. Moving on to the next question. Name the ophthalmologist from Bern who spent 2 years in India and is credited with 2 major breakthroughs in glaucoma. And your options are A, Franz Fankhauser, option B, Professor Hans Goldman, option C, Alfred Vogt, and option D, otohar. And your time starts now. So the correct answer is option A. So he was the chairman of the Department of Ophthalmology at the Medical College in Ludhiana. And he was the one who did not know what limitation of working hours mean. He was the father of automated perimetry, that is octopus, and also introduced Q-switched Nd:YAG laser. So moving on to the third question, diagnose this condition. And your options are A, it's worm in the anterior chamber. Option B is it iatrogenic trauma. C is detached Schwalbe's line in anterior chamber. And the option D is none of the above. And your time starts now. So the answer is option C. So it is detached Schwalbe's line, which is seen in AR syndrome. So the question 4. This figure is a graphic representation of the following instrument. Your options are A, ocular response analyzer. Option B is pneumotonometry. Option C, dynamic contour tonometry. And option D is Perkins tonometer. Your time starts now. Time is up. So let's see what is the correct answer. The correct answer is option C, that is dynamic contour tonometry. This graph is of DCT. So moving on to the last question of this section. What is an A-scan acquisition speed of Cirrus OCT, that is SD domain, spectral domain OCT? And in statistical terms, what is the green zone in OCT indicates? So here are your options. Option A is 27,000 A scans per second, and the green zone is more than 95% of the normal percentile. Option B, it's 27,000 A scans per second, and green zone indicates less than 5% of normal percentile. Option C, the speed is 10,000 A scans per second, and green zone indicates 95% of the normal percentile. And the last option is option D, that is 10,000 A scans per second, and it indicates less than 95% of the normal percentile. The clock starts now. So the time is up, and the correct answer is option A. So with this, I invite Dr. Manohar sir, who is a senior professor and head of the Department of Ophthalmology at SP Medical College, Bikaner. He has a teaching experience of 28 years. He has various presentations at national and state conferences. He is external examiner at many places in India. He is the executive member of Rajasthan Medical Council, NMC inspector, DNB examiner, and is a member of the various societies. So over to you, sir.
Welcome to all the students. This is the fifth section. So starting with the first question of this our quiz, that is the circular iris measure is formed by the anastomosis of your options are long posterior ciliary arteries with short posterior ciliary arteries. A. The B is the anterior ciliary arteries with the short posterior ciliary arteries. The option C is long posterior ciliary arteries with anterior conjunctival arteries. And the last one is D is the long posterior ciliary arteries with anterior ciliary arteries. Students, your time starts now. And the correct answer is, as you know, all the long posterior ciliary arteries coming with anterior ciliary arteries D choice. And the explanation, as you know, that the long posterior ciliary arteries with the anterior ciliary arteries, which are the branches of the ciliary main arteries itself, is a branch of ophthalmic arteries that form the circular iris major. The short posterior ciliary arteries that form the circle of Eller and Gin around the optic nerve. Now the next question is, Handler layer is present in which part? A at the fovea, B at the parafoveal region, C at the whole retina, D is the paramacular region. Your time starts now. And the correct answer is Handler is present in parafoveal region because it is present in parafoveal region which is in radial fashions. That's why whenever there is pupil edema, the edema and exudate are spread in radially, as you see by the fundus or various examination. Now the third question is, the weakest wall of human orbit is, or options are A, the roof, B is the medial wall, C is the floor, and the D is the lateral wall. Your time starts now. And the correct answer is the medial wall. As you explanation is that weakest wall of the orbit is the medial wall. That is due to the cribriform plate of the ethmoid sinus known as the lamina propria. And most common fracture is the floor of the orbit in the blunt trauma. Now the next question for you is, uriblepharon term is used for, your options are widening of the palpebral fissure A, B is the floppy upper eyelid, C is the narrowing of the palpebral fissure, and the last one D is the thickening of the tarsal border of the lid. Your clock start now. And the correct answer is that the A, that is the widening of the palpebral fissure. Why? Because this is the narrowing of the palpebral fissure. You note that is the blepharophimosis, thickening of the tarsal border called as the tylosis. So, in our section, the last question is, granulomatous uveitis is seen in all of the following except the choice are the A uveitis with ankylosing spondylitis, B is the sympathetic ophthalmitis, C is the tubercular uveitis, and D is the uveitis in sarcoidosis. Clock starts just now. And the correct answer is granulomatous uveitis seen in all, only not seen with the ankylosing spondylitis. That I told to you that it is present in the sarcoidosis, tuberculosis, Vogt kyanitis, sympathetic ophthalmitis, and the ophthalmia nodosum. So, madam, my first part is over. Now, mic is handed over to you again.
Yes, thank you, sir.
Welcome,
So
madam.
yes, we have completed our first set of 25 questions, and this is time for the commercial break. Now, it's time to declare the winners of the last episode. So these are the winners of the last episode, that is episode 6. So we request all of you to type in the question and answer box so that at the end of the episode, we can let you in and we can have a small chat with all of you. So with this, we'll start with the second set of the questions. And again, I invite Dr. Tushar Grover sir for the same.
Thank you, Dr. Shilpi. So we'll start with the section 6 now. So the first question is, which surgery is this individual likely to have undergone? So you basically have to look at this topography map and then tell me which surgery has this individual had. So the first option is hyperopic LASIK. Second option is corneal collagen cross-linking. Third is myopic LASIK. And D is none of the above. So your time starts now. Okay, so the correct answer is C, myopic LASIK. And the reason is that you can see that it's an extremely flat cornea centrally, and the pachymetry is also low centrally. So all of this is suggestive of previous myopic LASIK. Okay, so let's move to the next question. So when you look at this image, this is a patient who presents with this slit lamp finding, and he had trauma where he was punched in his eye 6 weeks ago. What is the pattern of resolution of the condition from the cornea? Of the pattern of resolution of this particular condition from the cornea. So your options are A, centripetally, B, centrifugally, C, patchy, and D, raster. Okay, and your time starts now. Okay, and the correct answer is A, centripetally. So let's move to the explanation. This is a picture of blood staining of the cornea. So the blood essentially clears from the periphery first and then to the center. So that is centripetal clearance. And especially in children with this condition, they're at risk of amblyopia. So let's move to the next question. The finding that you see in this image is seen in which condition? The options are A, Marfan syndrome, B, Hansen disease, C, Pseudomonas keratitis, Frederick's disease. Your time starts now. The correct answer is B, Hansen disease. I think most of you would have probably gotten this right. The picture here you can see shows enlarged corneal nerves, and they're associated with a variety of conditions like neurofibromatosis, Refsum disease, acanthamoeba keratitis, and of course, the answer that we had. Okay, so let's move to the next question. Now, this is an 85-year-old patient who has corneal deposition, as you can see. This is found only in his left eye. Which of the tests should the individual undergo based on this finding? So let's have the options. Option A is fasting lipid profile. Option B is genetic analysis for PITX2 gene mutation. The next option is echocardiogram. Option D is carotid Doppler. So your time starts now. The correct answer is D, carotid Doppler. So this is when somebody has unilateral arcus senilis, it's very rare and it can be associated with contralateral carotid artery occlusive disease. And therefore, the patient should undergo a carotid Doppler to rule that out. Okay, so let's move to the next question. Now, which of the following statements regarding a phakic IOL central vault is not true? So let's have the options. a vault of 250 to 750 microns is considered normal. A high vault is associated with a higher risk of cataract. The distance between the anterior surface of the crystalline lens and the posterior surface of the phakic IOL is referred to as the vault. D. Phakic IOLs with central holes are associated with a lower incidence of cataract. So which of the following statements is not true? Your time starts now. Okay, and the answer here is a high vault is associated with high risk of cataract is not true. So the central vault is, as mentioned, defined as the distance between the back surface of the phakic IOL and the anterior surface of the crystalline lens. All the other statement was true. A high vault is associated with a higher incidence of raise in IOP and angle closure and pigment dispersion, etc. Whereas a low vault is what is associated with a higher incidence of cataract. So that was the wrong statement there. Okay. So I think
Doctor
that's it from me.
Hanji,
Yes,
Hanji.
so doctor, please. Thank you.
Yes, so we'll start off with our next set of questions, and which is in section 7. So can we have the first question? Yeah. So Frisbee-Davis test is used for diplopia, measuring ocular deviation, stereopsis, or the intensity of nystagmus. And your time starts now. The correct answer is stereopsis. So it's a free space of real depth which avoids potential problems with stereograms, which would be like some young children may be unwilling to wear the red-green glasses or polarizing spectacles. So here you would not require all these. It can be used at just 3 meters. What happens is they are seen as free floating objects, these, without any visible means of support. And on each trial, one shape is said to be nearer to the observer. So one would be coming out and the other 3 shapes. And the patient is asked to say which one is this. So that is the Frisbee-Davis test. Next question. Our next question is, the most common muscle involved in congenital fibrosis of extraocular muscles is option 1, inferior rectus, option 2, lateral rectus, option C, medial rectus, or the superior rectus. Your time starts now. The correct answer is inferior rectus. So what is CFEOM? It's called as a congenital fibrosis of the extraocular muscle. It's a rare congenital syndrome characterized by non-progressive unilateral or bilateral restrictive strabismus, may or may not be associated with ptosis. The common findings are ocular motility restriction, usually upgaze. Why upgaze? Because the inferior rectus gets tight. So there is diminution, and so there is deficiency in the elevation. The patient could have hypotropia, could be orthophoric, could have iso or exo in primary gaze. So any type of strabismus is possible. And they could be unilateral or bilateral ptosis. Compensatory head position, usually chin up because the inferior rectus is tight, most commonly. There is generally poor visual acuity due to deprivational amblyopia from congenital ptosis. Next question. Yeah. The prism bar undercover test. So it's prism bar undercover test is done in option A, DRS, that's Duane's retraction syndrome. Option B, DVD, dissociated vertical deviation. Option C, double elevator palsy. And option D, CPEO. Can we have the timer, please? So the correct answer is DVD, dissociated vertical deviation. So what happens in prism bar undercover test? What happens here is that the patient is asked to fixate on a standard target, typically a letter optotype, and loose prisms are introduced in front of the non-fixing eye. So one eye would be going up, the other eye would be fixing. An alternate cover test of each eye is done using an opaque occluder, allowing only enough time for refixation and without allowing binocular fixation. The prism strength is progressively increased in front of the previously determined habitually non-fixing eye. So you keep on increasing the prism strength in front of the non-fixing eye, which is deviated upwards, until the deviation is neutralized. So that is what is happening. Your prism is under the cover, and that is the eye you are seeing. Next question, please. Yokoyama procedure is the treatment for Brown syndrome. Option B, Duane's retraction syndrome. Option C, myopic strabismus fixus. D, lateral rectus palsy. Your time starts now. The correct answer is myopic strabismus fixus. So in highly myopic patients, excessively long axial length can cause a type of myopia-induced strabismus, which is characterized by progressive esotropia and hypotropia, which means the enlarged globe displaces between the superior rectus and the lateral rectus. So it's in and down. It's also called the heavy eye syndrome. And based on this hypothesis, Yokoyama proposed a loop myopexy surgery of the muscle bellies of superior rectus and lateral rectus. So they were bound together to come closer because they have been widely separated. This was to restore the dislocated globe back into the muscle cone. And this surgery united the two muscles and re-established the physiological muscle plane, thus preventing the globe from prolapsing through the superior temporal quadrant. That is the basis for this Yokoyama surgery. So the last question in this five set of questions is, the average keratometry of a full-term neonate at birth is option A, 43.5 diopters, option B, 39.5 diopters, option C, 51.5 diopters, and option D, 40.5 diopters. Your time starts now. And the correct answer is 51.5 diopters. So you have a steep cornea when the child is born. So if you consider the keratometry values in different age groups, what happened is from birth to 6 months of age, the average value is around 48.27. So it's 51 to start with, but by about 6 months of age, it starts to decrease and goes on further decreasing as the child grows until at about maybe 5 years of age, when there is about 43 to 44 diopters of keratometry. So that is how is from a steep cornea to about 5 years when the cornea starts to stabilize. Thank you.
Thank you, sir. So I invite Dr. Archana, ma'am.
Yeah, hello, now starts. Let's start with the questions. So section 8, the first question is faricimab. Which statement is true? So faricimab is a very recent drug which is being used by retina specialists all over, creeping into the market. So it is a FDA approved for wet AMD only. Option B, it has inhibitory effect on angiotensin 2 receptor only. Option C, Bolbert and Sterry trials promise its longer acting effect in wet AMD. Option C, FDA labeled dose is 6 milligram. Your time starts now. So the answer is D, that is FDA label dose is 6 mg. This is the only true statement. So the explanations, Farcimab or Vabysmo, as is the trade macular edema, it has inhibitory effect on VEGF-A as well as ANG2. Bolvert and Stairway are the phase 2 clinical trials for DME and neovascular AMD respectively, and the FDA labeled dose for it is 6 mg, that is 0.05 ml of 120 mg per ml solution. Now the second questions in my set is, Pulfrich phenomenon is seen in option A is optic neuritis, option B, unilateral cataract, option C, cerebellar lesions, option D, both 1 and 2. So let's start the time. So Pulfrich phenomenon is seen in D, that is both optic neuritis as well as unilateral cataract. Pulfrich phenomenon, which is also known as Pulfrich effect, is a neuro-ophthalmic observation in which 2D objects are perceived as 3D due to slight discrepancies in signal transmission time between set of eyes and the visual cortex. As we all know, it is classically seen in demyelinating optic neuritis, but it is also reported in unilateral cataract cases, which can obviously be corrected by surgery. So your third question is trilateral retinoblastoma. Which of the following statement is true? Option A is, it is found in only cases of bilateral retinoblastoma. Option B, primitive neuroectodermal tumor is associated invariably, that is pinealoblastoma. Option C, TRB mainly develops in pineal gland and frequently presents with a cystic appearance that could be misinterpreted as benign pineal cyst. Option D, the prognosis is usually good. The timer starts now. So the answer is option C, that it develops in pineal gland. And let's come to the explanation directly. Trilateral retinoblastoma is a disease associating unilateral as well as bilateral retinoblastoma with intracranial midline primitive neuroectodermal tumor, which usually arises in pineal gland. However, in 1/4 of the cases, the tumor may develop in another intracranial region, which is non-pineal TRB, that is mostly in the suprasellar or parasellar region. These trilateral retinoblastomas develop in pineal, mainly develop in pineal gland, and there they can be misinterpreted as benign pineal cysts because of their cystic appearance. The treatment of these diseases is very difficult, and the prognosis is also usually poor. Next question. Which of the following is false regarding pegcetacoplan, that is Cyfovir? Option A, it is the first ever FDA-approved drug for all types of geographical atrophy. Option B, remarkable intraocular inflammation post-treatment has been noticed in real-world post-approval. Option C, it has a very poor there is a very poor compliance to this drug, is also known as an expected challenge in real world. And B is Oaks and Derby trial were related to it. Your timer starts now. So the false statement is option A, that is, it is the first ever FDA-approved drug for all types of geographical atrophy. So coming on to the brief explanation. Pegcetacoplan Cypherware is the first FDA-approved drug ever for geographical atrophy, but only for AMD-associated geographical atrophy. It is a pegylated complement of C3 inhibitor peptide that inhibits the C3 convertase. In the two phase 3 trials, Oaks and Derby, it proved its efficacy when given monthly or bi-monthly, but the potential side effects are well-known: CNVM, intraocular inflammation, and ischemic optic neuropathy. There was remarkable dropout of patients in this trial due to no subjective rewarding results because it only halts geographical atrophy but is not going to cause any visual improvement in the patient. So the last question of my series, recognize Dr. Arya Swaj, who describes Swaj-Matsua syndrome related to retinal detachment. So we have photographs of all these great ophthalmologists. We don't mention the name because it is directly related, the eponym is related to the name of the ophthalmologist. Your timer starts now. So the answer is option A, and this is Dr. Arya Swaj. So coming on to a brief explanation, Dr. Arya Swaj is the one who describes Swaj-Matsua syndrome, which is increase in the IOP in RD cases. And option B was Dr. Eugen von Hippel, who described retinal angiomatosis in VHL. C is Dr. Ernst Custodius, and he introduced scleral buckling. D is Dr. Theodor Karl Gustav von Leber, who has several eponyms to his name, like Leber's hereditary optic neuropathy. We had one of the questions regarding it today. Leber's congenital hemorrhages, etc. Thank you. Now handing over to the next quiz master.
Yeah. So coming to section 9. So the first question of this section is, what does X indicates in this graph? Your options are option A, P is less than 5% deterioration. Option B is possible progression. Option C is out of range. And the option D is likely progression. Your time starts now. So the answer is X indicates out of range. So in this glaucoma progression analysis, this triangle shows means P is less than 5%, that is deterioration. When the triangle is half colored, it is on the 2 consecutive visits, and the triangle, if it is full colored, it is 3+ consecutive visits, while X denotes the out of range. So coming to the next question, during lactation, which drug is absolutely contraindicated? Your options are option A, PG analogs, option B, beta blockers, option C, alpha 2 agonists, and option D, none of the above. Your time starts now. This was a simple question, and the correct answer is option C. So moving to the next question, what component is supposed to be neuroprotective in green tea? And your options are A, epigalactotation gallate, option B, bioflavonoid, option C, epicatechin gallate, and option D, epicatechins. Your time starts now. So let's see what is the correct answer. So it is bioflavonoid in the green tea, which is supposed to be neuroprotective in nature. So coming to the fourth question of this section, name the instrument which is shown here. Your options are A, Argus IOP sensor. Option B is Triggerfish CLS. Option C, Eye Care tonometer. And option D is none of the above. And the clock starts now. So time is up. And the correct answer is option B. The image shown or the instrument shown is the triggerfish CLS. So this records the data in millivolt equivalents rather than the millimeters of the mercury. And the conversion of millivolt equivalents to millimeters is a complex phenomenon because of the relationship between the volume and the pressure. It is not linear, it is non-linear. Coming to the last question of this set, the question is name the implant which recently has been withdrawn. And your options are option A, Volt microstent shunt, option B, Cyprus microstent, option C, iStent supra, and option D, Aqua shunt. Your time starts now. Time is up. And the correct answer is option B, that is Cyprus microstent. So this stent was voluntarily withdrawn because of the excessive endothelial cell loss seen in the COMPASS study. So with this set of question is over, and moving on to the last set of this quiz. So handing over the screen to Manohar sir.
Thank you, madam. Welcome again, all the students. This is last section of this quiz and 5 questions. So the first question of this, the earliest symptom of the sympathetic ophthalmitis is, the options are A is the pain, B is the photophobia, C is the decreased distant vision, and the D is the diplopia. Your time starts just now. And the correct answer is the photophobia. And as you all know that the earliest symptom is decrease in accommodation rather distance. So difficulty with that is followed by the photophobia. So in this photophobia will be the earliest, right? Now the next question is, which of the following anti-glaucoma medication can cause drowsiness? And the options are A is the latanoprost, B is the timolol, C is the brimodine, and the D is the adrenaline. Your time starts just now. And the correct answer is brimodine. The explanation is that brimodine is, as you know, alpha agonist, which causes drowsiness. Timolol causes nasolacrimal duct obstruction. Latanoprost heterochromia iritis, and the adrenaline is causes the conjunctival pigmentation. Next question is, yoke muscle of the right superior rectus is, the option A is the left superior rectus, B is the left inferior oblique, C is the left inferior rectus, and the D is the left superior oblique. So your time starts now. And the correct answer is left inferior oblique, because it is the synergistic muscle to the right superior rectus. So that's why the correct answer was there. The next question is, most common type of ptosis is, options are A is the aponeurotic, B is the mechanical, D is the neurogenic, C is the neurogenic, pardon, D1 is the myogenic. So our time starts now. And the correct answer of this is the aponeurotic, because the aponeurotic is the deescence of the aponeurosis, that is aponeurotic. Myogenic is caused by myasthenia gravis. Neurogenic is caused by the third nerve palsy and, as you know, the Horner syndrome, while the mechanical is due to the some lid tumors and the multiple chalazion. The next question is the last question of this quiz is retinal degenerations predisposed to retinal detachment include all except, and the options are: A is the lattice degeneration, B is the Snell tract degeneration, C is the paving stone degeneration, and the D is the focal pigment clumps. Your time starts now. And the correct answer is the paving stone degeneration, because this is involved mainly the peripheral retina and is corrected by the peripheral small discrete areas of the atrophy of the outer retina and is not a risk factor for the retinal detachment. So thanks to all the participants. Now Mike again hand over to or continue, madam.
Thank you. Thank you, sir.
जी madam.
So thank you all the quiz masters for wonderfully taking us through this journey of all the sessions. So I think now it's time for us to share the last time's.
We have already
We have already shared. So are there any of the previous winners of the last episode? Sai, can you let them in on the Zoom platform? We can have a small chat with them.
Madam, can you share that screen again, please, so that people can look at it again?
I think so. We can see that Asta Arun, episode topper were Macula, Team Macula, Acumen, Tulip, Orostar, House of Dragon, Opthal Nerds, Yoke Muscles, Dhanvantri, and Ripples. If you are there with us, and in the private practitioner winners were Vinit Kumar Batwani, Dr. Maushmi Banerjee, and Madhu Chasai. So please log in to the Zoom platform. We would love to interact with you, have you on the Zoom platform live. The viewers would love to know who are the consistent performers or who were the performers, top performers in the last category, last episode rather, I should say. Can we have Dr. Vinit Batwani, Dr. Maushmi Banerjee, and Dr. Madhu Sai? Any of them have logged in? Shall we stop sharing? Yeah. I think it's a Valentine's Day. Everyone is in a rush. I request all the quiz master to come live now. Get the video on as well. Tushar, Dr. Jaspreet, Dr. Archana is there with us.
Yes.
Yeah. We'll have the previous episode winners, top performance. We will have them on the Zoom platform. We'll just have a small chat with them before we wind up. Sai, any one of them have logged in?
Yes, doctor. Yes. Dr. Shruti, Dr. Parna,
Yeah, Shruti, come on.
Subiksha, Dr. Vasavi, 5 of them.
Shruti, can we have you live? Get your video on. Shivani. Yes, can you just introduce yourself, Shivani? Yes, there. Get yourself.
Hi sir, this is Shivani here.
Hi sir, this is Priyanka here.
We are from JSS Medical College.
Mysore.
Mysore. Good. And who is your mentor?
Dr. Bindu Malini.
Okay, good, good, good. Congratulations. So which year resident you are?
We are
Final
5
year.
years.
Final year. So last time you were amongst the top 10. How about this time? How did you perform this time? Were the questions quite difficult?
So few of them were the ones from retina were a little tough, but
Okay. Okay. So I knew few of these, Jaspreet, Archana, Tushar. Let me make a frank admission. Even I found your questions quite tough for me. So these guys, you were really testing the patience. But I am sure these students, our next generation, are really very sharp. They would even crack the most of the difficult questions. क्या बोलते हैं जसप्रीत जी बोलिए. You're muted, Jaspreet.
Yeah, I mean, I think probably it was a test for their exams now, because final years would be giving the exams soon. So it was like a balance, some easy and some tough questions, but overall, you can say a very good, you can say, set of questioning which was going on.
Good. Thank you. Oh, Vinit, फिर से आप आ गए. Vinit is a habitual winner. He in a private practitioner category. Every time he takes away some money from us. Unmute कीजिए.
हाँ सर. हाय सर.
बोलिए भाई कि पिछली बार क्या सेकंड नंबर फर्स्ट है ना.
फर्स्ट
Last-
था. लास्ट टाइम सर प्राइवेट प्रैक्टिशनर में फर्स्ट था और मैं फर्स्ट क्विज का क्विज मास्टर भी था.
हाँ वही मैं बोल रहा हूँ. इसीलिए तो वही सोच रहे यार कैसे करें. अभी आपको हम लोगों को ये करना पड़ेगा. रेस्टिकेट करना पड़ेगा. यू हैव टू बी बैंड फ्रॉम फर्दर.
जो रिवाइज होता रहता है ना क्वेश्चन देखने पे.
Okay. Good. Congratulations, Vinit. And we are happy to have you as a quiz master as well. Okay. So now we have Dr. Shruti. Shruti, can we have you with us? Dr. Vasavi? Yeah, Shruti, come on, tell about yourself once more.
So good evening. We're final year residents from JIPMER. So I'm Shruti Fatima.
Yeah, a deadly combo since last every episode you are amongst the top 10, I believe. In all 7 episodes you have been?
Yes.
Okay. So keep playing that. To one more episode of preliminary round is left. After that, we would love to see you into quarterfinals and finals, of course. Okay.
आज
Best of luck.
सबसे ज्यादा डिफिकल्ट क्वेश्चंस किसके लगे?
I
हाँ
think pediatric of just reads.
just I knew all the pointers are going to be pointing towards you.
Hello, it's a good revision for the exams.
Yes, sir. Yes.
Good. And how was Tushar, by the way, as a quiz master? Very tough. Or as
I
sweet?
sir, I'm not sure what they thought of it.
And I'm asking the girls, Shruti, or
It was fine. So it was a good balance overall. But yeah, it was a little more difficult than the other
Okay,
rounds.
good. So keep playing. Looking forward to seeing you again on the screen next time when we declare the winners. Okay?
Thank
So,
you, sir. Thank you.
Dr. Subeksha, Dr. Moshmi. Yeah. Dr. Subeksha, you come on, introduce yourself.
Good evening, sir.
Come on, tell us about your.
The final residents from Coimbatore Medical College, sir.
Good. Tell your name.
My name is Dr. Subisha. This is Dr. Vinodini. Our mentor is Dr. Jeevakulas.
Very good. Very well played. I think
Thank you,
I've
sir.
seen you again. This
Yes,
is your
because
last
pet
time.
is also there.
Correct. And just show your pet for the sake of other masters. Is it a lucky charm for you that every time that point is there, it doesn't distract you?
No, sir. He just sits.
Quietly.
Yes. Most of the time, he's quiet.
Okay.
His answers, Dr. Subiksha?
Sir? Sir?
Pet advising something to you or not?
Is it
No, sir.
They are asking, are they the mentor and or giving some clues to you while you are answering?
No, sir. No.
Or just a lucky charm?
Just a lucky chance.
Good. Congratulations. Well
Thank
played.
you. Thank you, sir.
Dr. Moshmi, she's in the private practitioner category. आपके बारे में बता दो मौशमी.
Hi, sir.
बता दीजिए आपके बारे में. Introduce yourself, मौशमी.
Hi, sir. Can you see me?
Yes, of course.
Okay, I can't see. Hi, sir. I'm Dr. Moshmi Banerjee. I'm working as an assistant professor in Maharaja Agrawal Medical College in Agroa right
Very
now.
good.
Welcome.
Thanks.
Thank you. Thank you. Well played.
Thank you, sir.
Very well played. आपकी टीम नहीं अपने फील्ड की है?
Sorry, sir.
आपने अपने कॉलेज से टीम नहीं फील्ड की है?
नहीं, sir. बाद में मैं यहाँ बाद में आई हूँ, sir. Before that only I think the big queue had started.
And next time I would love to see you as a
Yes.
member of one of the teams from your colleges.
Yes.
Okay?
Yes. Yes.
Good. Well played.
Thank you.
Wasabi? Wasabi, we
Good evening, sir.
Wasabi,
Myself.
come on.
Yes.
You played all alone
playing-
today again.
Today I played alone only, sir. Every time she's not available. Most of the times I'm playing alone.
See, but isn't it a risky proposal? You will make do all the efforts, and when it comes to prize money, she will be sharing 50% of it.
No problem, sir. But most today also she's not available because.
Okay, it's a Valentine's Day, so make a proposal to her that you get 50% of whatever I win, whether you are there with me or not. It's a typical love story. Good. Well played.
Thank
Come
you,
on.
sir.
Okay, Archana Singh. Hello. Anyone else has joined? Yeah, come on. Yes, do introduce yourself.
Good evening,
Good evening,
sir.
sir.
Sir, myself Archana Singh. I'm Dr. Priyanka. So we are from AIMS Raipur, JR3, both of us.
A mentor is Dr. Madhuri.
Ek last question, because you are amongst the thing. Today is Valentine's Day. You are all young enough, not oldies like Tushar with a gray beard or like Jaspreet, okay?
Dr.
Or
Murli.
Manohar sir. How come you are with us on the quiz day, on a Valentine's Day with a quiz?
Sir, since we are JR3, we are focused more on studies right now.
कितने बोर लोग हो, कैसे हो गए ऐसे से? But we are happy. Come on, it speaks about your commitment. I was just pulling you. So well played. Come on. Congratulations. Keep playing. You should always be focused as a resident when you're doing all this. Valentine's Day come and go. You might have multiple Valentines till then. We will look for a Valentine's if you have money in the pocket and some more degrees in your pocket. Correct? Very well. Good. Congratulations. So now I think it's time for us to wind up. है ना? और कुछ है? Okay. So congratulations. So now it's time for us everyone to wind up from our end, Big Q team. Thank you all the participants for being with us and playing with us so well. We will be meeting again on 28th of February at the same time with new set of quiz masters. That will be the last episode of preliminary rounds. And my sincere most thanks to Dr. Archana, Dr. Jaspreet, Dr. Manohar sir, Dr. Tushar, and of course, in absentia, Dr. Rajul for being with us, for all conducting, creating such a wonderful and interesting quiz, which was also a learning experience for us as well. Thank you once more, and I'm really sorry to all the quiz masters for nagging you for getting all the questions after it. Especially, I'm saying sorry on behalf of Shilpi. So it's not old more, but just it's time for us to say bye-bye. Everyone's Valentine's, call it a wife, must be waiting for all of us. Let us rush back. Bye-bye.
Thank you, sir. It was a pleasure. Thank you.
Thank you.
Bye.
Thanks a
Bye.
lot.
Thank you. Thank you for the invitation. It was a nice experience.